Hey everyone, this is my presentation for the development of a curriculum I did to address the symptomatology for anxiety disorders in a group format. There are a few different reasons why I decided to focus on anxiety for my topic. One of the main reasons is just really in my short period of time interning. I've just been really surprised at how many people I see in the clinical setting that are struggling with symptoms of anxiety. Also, just in doing some brief research, I was pretty surprised at the statistics regarding diagnosable anxiety in our country right now. And so, for instance, in the last year, 19% of the United States population will have experienced symptoms of anxiety that are diagnosable. And over the course of the lifespan, that number rises to 33%. And so, what that means is 60 million people in the last year have experienced symptoms of anxiety that are diagnosable, and 100 million over the course of the lifespan. And that's just a huge number, a very large percentage of the population. And as I further my understanding of anxiety and how to help people reduce those symptoms and learn how to manage anxiety, I just felt like it was important that I also know what the pros and cons are of doing that in a group setting. And so that kind of mixed with my own experiences with anxiety and walking through some of those things and just seeing how difficult that can be at times really just has kind of um, provoked a desire in me to help those struggling with those issues as well. And so research shows that a transdiagnostic treatment of anxiety disorders in group settings yields a positive results. And what that means is that while there's several different anxiety disorders in the DSM-5, there's a lot of overlap of the symptomatology for those disorders. And so research has shown that it's acceptable to address different anxiety disorders within the same group. There's also been significant evidence that supports the efficacy of group therapy for treating anxiety disorders, and particularly from a CBT approach. And that's what I'm going to be using for this curriculum is a cognitive behavioral therapy approach. And basically, CBT attempts to decrease maladaptive behaviors and cognitions, and you're going to do that by identifying consequences, modifying maladaptive cognitions, looking at the individual self-statements and beliefs, also while implementing adaptive behaviors or positive, healthy behaviors and new learning styles. And CBT has really kind of become a gold standard for dealing with anxiety. And so, while there are other approaches like ACT that are super effective as well, I just felt like in my own life, the approach that I've used that has worked well has been more under the CBT umbrella, and so I figured in leading a group, I would be more effective doing something that I'm familiar with. Also, in my research, I found that exposure therapy is super helpful for reducing symptoms of anxiety and also completely overcoming fears. And so it's being consistently shown to be the most powerful approach to overcoming fears. And basically, the goal of exposure therapy is going to be to reduce a person's fearful reaction to a stimulus by providing a systematic confrontation of the stimulus. And so, what that would look like in a group setting would be individuals naming what their fears or what produces anxiety in their life and setting up hypothetical or even real life situations where the individuals are able to face and confront those fears and anxieties in a safe and guided format. Um, so, for the formation of this group, cognitive behavioral therapy and exposure therapy group, I figured the best way to get the word out for something like that would be to develop a flyer. And that could be distributed by taking it to different counseling offices around the community, or by social media, Facebook, Instagram, sending out emails, and word of mouth. And so when the advertisement had been sent out for the group, it would be focused towards adults 18 years or older, and a screening process would take place after that. Uh, One thing that I feel like would be helpful for that is using an anxiety evaluation. Something that I use a lot with my clients is called a PROMIS emotional distress, and it's a level 2 anxiety adult evaluation. It's super quick and simple. It just takes a couple minutes to fill out, and it helps track the individual's anxiety over the last 2 weeks. And so that's been helpful for me in individual settings to track the progress of the client's anxiety symptoms over the course of treatment. And so after administering the PROMIS eval to individuals who are interested in the group, um, basically, if they scored within a moderate or severe range, which would be a T score of 60 to 82, they would be considered for the group, and then complete an over the phone interview to determine whether or not their symptoms of anxiety are significant enough to qualify them for an anxiety disorder diagnosis, and also access to participating in the group. I figured with dealing with individuals with anxiety that being in a group in general is probably going to heighten that anxiety. So I try to limit the number of members in the group to 7, and that would be a commitment to a 10-week process for 2-hour sessions each week with a 2-hour follow-up group 2 months after the commencement of the group process. So goals for the group and the function of the group, using the PROMIS anxiety evaluation I was talking about, um, that would kind of establish a baseline at the beginning of the group for each of the individuals. And that would be the PROMIS eval would be administered each week at the beginning of the session to track T scores of the client's progress, whether they're getting better or worse. But the main goal, I think, from a leader perspective, would be to reduce each of the group members' anxiety by 1 level. And so if they were scoring in a severe range, to drop it down to a moderate. If they were scoring in moderate, to drop it down to a mild range. Um, Yeah, and then so also I think it would be important in the first session to have each of the group members establish some long-term goals over the group process, and then also at the beginning of each session establishing kind of a weekly goal for the members individually. Um, like I said, this group would take place over a 10-week period, and there would be 2-hour long sessions each week. At the initial group meeting, I think it's important to have introductions of the group leader, kind of an overview of what the group is about, the purpose of the group, curriculum, also including some psychoeducation on anxiety disorders in that first group, and the therapeutic techniques that are going to be used. So going briefly over CBT and exposure therapies. Another thing that would also be done is, as we already talked about, establishing goals, and just beginning that process of establishing therapeutic relationships and alliances between the leader and also the group members. So the sessions following that first one would begin with a brief check-in process where the leader or mainly the group members would voice their struggles, their overall well-being, concerns, and needs with the group, and establish their goals for that week. During that little 15-20 minute check-in period, the individuals would also complete their promise anxiety evaluation each week. Um, and then after the check-in process, doing a little psychoeducational piece for whatever the topic is for that week. And that would run 30 to 45 minutes. And then each group in the second half or second hour would be an open discussion format for individuals to process what they're learning, what they're struggling with each week, their progress, issues within the group, really just anything related to the group or individuals walking through their anxiety. Um, and so the first 4 sessions would specifically have a psychoeducational piece within that first hour. And then you can see in the handout, beginning in week 5, there would be a bit of a transition while there would still be psychoeducation going on throughout the process, filling individuals in on um, coping skills and ways to manage their anxiety. There'd be a shift to using exposure therapy in the group sessions. And so that would look different ways. I thought it would be helpful to have in the first exposure therapy session, have the individuals or the group members each make a list of 10 anxiety producing situations or fears that they have and list them from least to greatest. And then so in concurrent weeks, there would be some activities, like one of them is share for 3 minutes with the group about something you enjoy doing, and allowing the individual to do that in front of the group, maybe exposing them to anxieties of public speaking or speaking in front of groups. And then also the leader's objective in the process of exposure therapy is really going to be to help guide the individual through that process, but also helping them debrief from the situation. And so um, providing a space for them to process the feelings and emotions regarding the exposure they just did, their concerns for doing it in the future. And that process by the leader is going to have to be handled really delicately. Um, a lot of the research that I saw on using exposure therapy in group settings says that the dropout rate increases quite a bit once you start doing exposure therapy. And even though exposure therapy is the most effective treatment tool for overcoming fears, it is probably one of the more difficult therapeutic techniques that you're going to use in any form of therapy. And so just taking that into consideration as the leader of the group would be essential. Um, Anticipated issues with a group like this. I mean, in general, in a group process, I think that people are going to struggle with hesitation and anxiety about being in a vulnerable group with a bunch of people they don't know. For a group specifically devoted to anxiety disorders, I think this would be heightened quite a bit. And so walking through some of the stages of a group may take a little longer. And really, I think the way that the leader should handle this is to promote an open discussion of concerns or fears or whatever the individuals may be experiencing regarding their hesitancies to the group. Um, Another thing to take into consideration would be um, the cultural aspects of people engaging in a group like this. I think that individuals from different cultures may not feel as comfortable talking about personal information with people they don't know. I think that's already kind of true in a lot of our cultures here in America, but that may be intensified for individuals coming from other cultures, and so it would be important for the group leader to be aware of that. So over in the process of the group and through the commencement of the 10 weeks, tracking the individual's personal goals week to week. One thing I forgot to mention is that they would also be keeping a journal throughout the group process in between sessions to document different anxiety producing situations, their feelings and emotions around that, and the responses that they had to those situations. Um, but at the commencement of the group, the promise anxiety evaluation would be administered again, and just to kind of see what happened to the members' symptoms of anxiety over the process of the group. Then a 2 month period would take place where the group would not meet and come back for a follow up group session. And really, that would be just kind of a check in point for everyone to see how they're doing, see what adjustment needs to be made, long term goals for the future, and to have an open discussion forum about those types of situations. And that would conclude the anxiety group from a cognitive behavioral and therapy approach. Thanks, guys.